Alicia,
Absolutely.
customized lifestyle solutions for body composition management. And why I think this is actually great that me and Alicia get to talk about this is because we kind of have two different approaches. So I'm a chiropractor, also have a master's of sports rehab, and kind of take like a physical approach to everything when it comes to body composition and management. And then Alicia, on the other hand, is a functional nutritionist. She's going to talk about different diet and lifestyle modifications that you could do just to basically just keep your body composition where you want to be. And so, what we're going to start with is I kind of just wanted to start it off with if anybody has Netflix out there, there is a show on Netflix called Live to 100 Secrets of the Blue Zones. Highly suggest watching it. Not only does it talk about like what you put in your body from the food standpoint, but what I'm going to dive into, just me being a chiropractor, is about how movement and just like simple things is just how a leisure walk can affect your body composition. So what we could start with is, everybody thinks that, oh, I'll just go for like everybody, I guess, doesn't know the importance of like what walking does
Right.
for you.
Basic movement.
Basic movement, absolutely. So that Blue Zone show, they actually went to Sardinia, Italy, and they were talking about all these different centenarians and all these people over 100, and they were trying to see, why they're living to the age they're living
Right,
to. And
right.
the big thing about Sardinia, Italy, was the elevation, and they walk everywhere. And just something so simple, it's just every day, just walking and not getting in your car and commuting everywhere. Just movement is going to be just a great way to kind of just a start.
Absolutely so. Absolutely so. I feel like we take it for granted. I mean, movement is the basic, just fundamentals of our body, and it really helps you be structurally sound. So that's definitely an area that I hit on with my clients. It's just making sure you're getting out and moving, and it doesn't need to be a high intensity going to the gym, running. Basic movement is just very important, and something to even aids with lymphatic drainage because you're moving your limbs. So
100%. One of the phrases I like to use is "motion is lotion."
Yep.
If you are not moving through your full range of motion, you're not only is your body going to get locked up, but you're basically just not cardiovascular exercise and
Right.
everything. And just to kind of touch base what Alicia was talking about, it doesn't mean you have to go out and do a hit train for 40 minutes. Even just certain things such as gardening, cleaning up your house.
Right, exactly. Yard work. Yard work's a big one. I know you do that a lot on the weekends.
Absolutely. Yeah. Yep. I'm going to be doing it later tonight and tomorrow too. And so not only does exercise kind of help with the body composition, but I kind of just want to talk about what it does for your brain as well.
Sure.
A lot of patients I have coming in, whether you're teenagers, young 20s, when I check their medication list, a lot of patients are on SSRIs or SNRIs, so kind of like antidepressant. When you exercise, you have a natural release of your endogenous endorphins. So that's like your natural feel-good chemicals. So usually when I have a teenage kid coming in, I'm always asking their parents, hey, Judy, does she play any sports? No sports. Well, what's she do when she comes home from school? Well, she kind of just sits at home, plays on her phone, just watches TV. Okay, so she's depressed, she has anxiety. Yeah.
Right,
Does she do anything? Like we were just talking about, just a little bit of exercise, walking, bike riding, just movement. You're just going to have a natural release of your endogenous endorphins, so you're just going to feel better. So I'd say free therapy.
Absolutely so. And it's those habits, too, I feel like, Dr. Rosh, that we were talking about. Really just shifting your habits can really just shift the whole terrain of your body.
Yeah, absolutely. And then so I'll kind of just talk into like a couple of the cheats we have if you kind of want to have proper body composition. So one of the big things we have that a lot of patients like to utilize here is the infrared sauna. And I'll kind of just show you the difference between like a conventional sauna and an infrared sauna. So conventional sauna, you could think of it kind of as an oven. So it's going to kind of heat the air around your body, and that's basically how you're going to sweat. What the infrared sauna is, it actually heats up. Think of it as kind of like a microwave. It's going to heat up the molecules in your body, so you have the detox effect. And when everybody's talking about weight loss, that's just a very passive, easy modality you could get into. I guess just drop some weight.
Absolutely so. It's going to heat you up from the core as opposed to the space around you.
Yeah, correct. And then we also in the back room have something called a whole body vibration therapy. So it's basically, Bob used to call it the shake machine. So you essentially just stand on it, and not only does it help with lymphatic drainage, but actually there's studies that you could actually burn calories doing it.
Absolutely so. I mean, I love those good biohacks that we have. You know what I mean? It's little, like you were saying, little cheats to kind of get your body moving.
Yeah.
Because we want results, and they're quick.
Yeah, absolutely. And And then the last one I'll dive into is the whole body cryotherapy.
One of my favorites. I
yeah.
love doing cryotherapy.
Whole body is great. So not only does that does a couple different things. That kind of helps with a catecholamine release from your brain. So it helps with norepinephrine, epinephrine, and dopamine. So you'll actually feel better when you get out. But since we're kind of talking about lifestyle and body composition, there were certain females at my other clinic I was working at would walk in and I was like, they're not an athlete. They're just walking. What are they getting in there for?
Yeah,
when
no.
you research it, you actually burn anywhere from 500 to 800 calories just from one whole body cryotherapy session, which I did not know.
Yeah, it is. It's fantastic.
Yeah.
It's like a morning cup of coffee too. It's
Yeah, because
nice.
we usually had a lot of our collegiate and professional athletes coming in for it, but then yeah, you're seeing like everyday people. You're like, what the heck they getting in there for? Weight loss.
Right. Weight loss calms down the inflammation in your body as well.
Yeah.
So it's a real good resource.
Absolutely. And then what I think we're going to do is, Alicia, do you just, I guess, maybe the easiest way we do this is just kind of walk through your assessment, like if you're seeing a new patient.
Absolutely so. So, the things that I like to work on are really something that I like to call the epigenetics. And what that is going to be, it's going to be disease, but it's influenced by your behavior, by your habits, by your lifestyle. And I'm really passionate about empowering people because you can take some control of your health doing those things. Because again, every illness, is going to be influenced by your habits, by your lifestyle. So, what I like to do is after a thorough assessment, which I like to call an art, so thorough assessment, recommendations, and then tracking. So when I do that, then I'm going to help determine which habits or lifestyle modifications that we can change, that we can work on together. And some of those lifestyle factors are going to be things like your diet, okay? They're going to be things like your sleeping. They're going to be things like movement, stress. Stress is a big one. I mean, I find out that, when we work on things like breath work, when we work on things like meditation, that's going to calm down that cortisol level. And ultimately, when we do these shifts, it can aid in weight loss, okay? So I think everyone's kind of wanting like the magic pill, or we're wanting like that, we're working out so hard and heavy. But sometimes that control is within you. So when you're modifying your sleep, when you're modifying your stress, when we're making sure you're going to the bowel movement, you're having a bowel movement rather, those things are going to aid ultimately in your weight loss.
And it's so funny because there's a zillion patients that come in. Hey, how's your stress level? Oh, I'm fine. I'm cool. I sent them for lab work, and we both look at it. Their cortisol's through the roof. You're stressed.
Yeah, exactly.
Even though you don't think you are, subconsciously you are stressed. And just to kind of piggyback off of Alicia, if you're fighting cortisol, if you're fighting inflammation and stress in your body, if you're looking to drop weight, get your joints to feel better, you want to exercise but you can't because you're in pain, you got to make the lifestyle modifications just so you can essentially heal, so to speak.
Absolutely. So that's kind of what I like to do first. It's really clearing those muddy waters, like getting rid of taking care of the terrain first, so then ultimately we can be here. But if we're not managing that stress, if you're not sleeping, if you're not eating enough, I see that so much where clients, they want to just not eat because they think that's going to help with their weight loss, but then in turn it's really causing metabolic dysfunction in their body.
1,000%. And that is why I like to work with Alicia, and I send a lot of patients to Alicia is just because I'll do all the treatments in the room, but it's not a cookie cutter approach. Everybody comes from different walks of life, different backgrounds, different lifestyle, and it's so nice because and we'll kind of dive into a couple patients that we treat, some John Does, and just kind of talk about the response that we got, and there's pretty significant weight loss with a couple of them.
Fantastic.
But just like a little case that we have, we've been seeing this patient, I'm going to say maybe 4 months.
Okay, yeah, I'm thinking it's definitely about three to four for sure.
3 to 4 months. So she came in, and she came in and she was having multi-joint pain. So she came in and she was like, I have a pain in my feet, my ankles, my fingers, my hands, and it just wasn't adding up. So we went through a comprehensive health history, and it's not adding up. We treated her. She felt a little bit better, but she wasn't making 100%. She wasn't getting 100% better. And so what I did was, a lot of people don't know, but I ordered lab work, and so we sent her for pretty extensive lab work just because she had lab work prior, but they were not testing certain things. Long story short, we sent her for lab work, and she came up, and her rheumatoid factor was through the roof. So she has rheumatoid arthritis. And she was actually a great patient. Instead of getting kind of depressed, why me? I have RA. I'm not going to be able to kick this. She was like, all right, what's the next step? So I was like,
Yes.
go talk to Alicia.
Yes. It wasn't for her. It wasn't like, why me? It was like, oh, me. And then she's going to, trying to figure out how she can address it and how she can deal with it. So it's been wonderful.
Yeah, 100%. And so with rheumatoid arthritis, it's it's basically an autoimmune condition, and it's an inflammatory arthritide. So the biggest thing is we're gonna have to heal the gut, and I'll let Alicia kind of talk about that. And we had to get her inflammation down because she was going to continue to be in pain unless we combated the inflammation. And she actually, it was really really cool. Alicia came in, I think it was just 2 weeks ago. She's like, oh, I got to tell you about patient because
yes.
she dropped how many pounds?
I think it was like 15 pounds.
15 pounds.
Yes.
Yeah.
Yes.
And she I gave her just a couple of different things she could do exercise wise, but Alicia did a great job just basically looking at her as a whole. Again, not a cookie cutter approach. She has a different condition, and you got her on a couple different supplements you could talk about.
Absolutely so.
And then just dietary changes.
Yeah. And really, too, that's where it is. It's all about bio-individuality because we're not all the same. And with a lot of autoimmunity, the stem, I'm a root cause practitioner, so I'm trying to stem, like, where is it coming from? And with her, it was the inflammation. So we really did take a look at her diet, and, once she was tracking, because that's so important, when she was tracking what she was doing and what she was eating, it was becoming more aware to her, like, okay, I am having a lot of sugar here, a lot of sugar there. So we really changed up her diet and made sure we were adding in foods that were anti-inflammatory, like salmon and berries, cruciferous vegetables, leafy greens, and then we added some supplements like our SPM that's wonderful to combat and calm down that inflammation. We added her on a good probiotic because I wanted to help her gut. We added GI Complete because, again, focusing heavy on the gut. Most disease is going to stem from your gut. So it's very, very important to kind of calm that down first. Then you can have a better approach of healing her. And it's been tremendous to see her efforts. You got to put the work in, too. I'm all about empowering. I'm all about educating and helping you, but you have to make that change. And it's been great to see her really thrive and make those changes and it's aiding in her weight loss, but then her energy level's up. So she's able to play with her grandkids, and she's super busy. She plays the piano. So it was important for her to not have pain in her fingers. But it's been a wonderful success story, and it's I'm just really proud of that.
And we see the results all the time. We could talk about a handful of patients that we've been doing the same thing with.
Yes.
And to piggyback on what Alicia just said, tracking. So that's why I like doing lab work because, yes, you could go off of how you feel, but at the same time, it's nice to have an objective measure. Hey, here's your numbers. And we got her lab work. We're actually due to get her lab work end of October just to kind of reassess after 4 months. But long story short, you could go based off how you feel, but she's been having multi-joint pain. And she just wanted to play with her grandkids. She wanted to have a lifestyle and exercise without pain. And so we took an objective measure. We basically checked her hormones, we checked different vitamins, minerals, and then inflammation markers. And I cannot wait to see, especially with her on the SPMs and all the GI protocol, where her CRP is after the 4 months. And then if we get her consent, I would love to blot out her name and then kind of share her results, coupled with the supplement she was taking to see where her RA factor and then her C-reactive protein, how I know it's going to drop.
Absolutely so. I'm very excited to see that. It's definitely going to drop for sure. But again, the change has to come from within. I'm all about educating and empowering, but you got to make the first step. And I'm accepting new clients. I would love to see you. I'd love to come in, have you do an assessment. And it is all bio-individual. So we'll do things, in addition to the assessment, we'll do a Zytoscan, which is biocommunication, identifying imbalances. We can pick up toxicity levels and vitamin deficiencies with an oligo scan. So we really try to customize it. And then, like Dr. Ross was saying, we have all these great biohacks with our infrared sauna and our vibration plate. And
and then another one that we got recently was the cloud therapy.
Yes, that's one of my favorites. I love it because it's hitting you on a cellular level, and basically all disease and dysfunction is stemming not only from the gut but cellular dysfunction. Okay, our cells in our body, they're not communicating as they should. They become tired, they become sluggish, and that's just due to lifestyle, guys. That's due to lifestyle. That's due to environment. That's due to our food sources. So when you get on this PEMF mat, it kind of calms things down and it really wakes up the cells in your body to function better.
100%. My analogy I like to tell patients is essentially like recharging the battery of your cells. Long story short, PEMF stands for pulse electromagnetic field therapy. Long story short, we'll just pick a general number. There's different resting membrane potentials all throughout different cells in the body, but roughly the normal resting cell membrane potential is around negative 70 millivolts. When disease and pathology in your body kind of run rampant, is because your cells get a little bit more leaky, so they get more positive, so kind of going closer to zero, so like negative 35, negative 30. What that mat does is when you lay on it, and it's awesome because you can literally lay on it and take a nap.
Right,
if you want.
exactly.
Yeah.
Right.
And you basically lay on it, it's going to basically charge your cells a little bit more negative so disease and pathology cannot spread. There are numerous studies with patients with Parkinson's. I actually put my Parkinson patient on it. This was end of last week. And so every time he comes in, not only do I treat him chiropractically and use the laser just to kind of increase the dopamine to his brain, but then we put him on the PEMF mat and it's going to help combat his Parkinson's
Absolutely.
symptoms.
So it's just a nice way to just to calm the body and just reset it. You don't necessarily feel anything when you're on the mat, okay? But just know that internally it's doing so much good for your body and for your cells, and it's just hitting you at that cellular level, waking things up so you can function better, so you have more energy, so you're sleeping better. It's just another resource we have to help you feel better.
I would have to say some people say they don't feel anything on the mat. I felt my I felt my gut going crazy, to be completely honest with you. That's what I felt on the mat. But I would also be remiss if we did not talk about, when we're talking about different kind of body composition, right? So that's basically looking at your bones, your tissue, and basically looking at your whole body as a whole. I have a lot of patients coming in with osteoporosis, and where I kind of come into play. I love giving patients just home exercises that you could do for osteoporosis. So osteoporosis, basically you're losing bone density in your bones, right? Very, very common. Like the poster child is a middle-aged, thin, frail woman.
Yeah.
And so there's two pros to being obese: insulation and bone mineral density. Besides that, no pros to it.
Nothing else.
Yeah. So long story short, like the two supplements that people were responding great, and I cannot make this up. She got her DEXA scan, I believe this was 3 years ago, and she was osteoporosis. And before that, the precursor is osteopenia. Long story short, she got on the Super Cal Plus and our Super K2 Plus, and I gave her a couple different exercises that you could do and just lifestyle tips you could do. For example, she's an avid walker. Okay, so you're walking. Do you do anything else besides that? No, I just kind of like to walk. I don't really weight train. Well, if you just like to walk, how about you buy an 18-pound weighted vest and put that on when you walk? Because how you're going to create more bone density is a load on your bones. That's how your bones are going to basically create, more density, so you're getting out of the osteoporosis. And she got her DEXA scan. This was earlier this year, and I can't make this up. She literally reversed it. She went from osteoporosis back to osteopenia, which is pretty darn cool.
That is fantastic.
Yeah.
That is fantastic.
So you like hearing little wins like that. And then do you want to talk about anything else when it comes to kind of like what you do in the treatment room?
Yeah, and just kind of piggybacking off of that, structural integrity, it's important. That's one of the foundations that I'll work on with my clients. You got to have a strong house, and that can be as simple as doing body weight squats. As we age, when you fall, like that could be a death sentence, okay? Like we see it all the time, just the severity of when someone falls or when you break a leg. However, if you're working on the structural integrity of your house, that's less likely to happen. So those are things that I will work on with clients and just remind them. So it doesn't have to be hitting the gym super hard. It can literally be doing a body weight squat or holding your grandchild while doing a squat. So those are things that I work on. I do want to share several success stories that makes me feel fantastic. There is one in particular, a client that I was working on, the mutual one that you referred me to, and she was having trouble losing weight, and she was so concerned about losing weight. However, backing it up, her stress level was so high. And, once we were able to manage that stress, and she was, doing things like the breath work, she was making sure she was hitting the gym. And, we're seeing her weight loss. We're seeing it because she's managing it from other avenues. So
Yeah, and to speak to that point too, she actually, long time patient, been treating her 5 or 6 years. She first came in to me, she was having chronic migraines, and we would treat her. She'd feel great for a couple months, and then in a return. Sometimes you treat her, she comes back in a couple weeks, doc, I'm still having a migraine. Treat her, and it was so funny because I was like, you know what, she travels a ton for her occupation.
Yes.
And she's single mom, and she's stressed to the gills. And so I was like, why don't you go meet with Alicia and just have a consultation with Alicia. And it was so funny because I was seeing her about every other month, and now I just spaced her out for 4 months because her headache frequency significantly diminished. Basically, what Alicia had her with her supplements and then her diet.
Right, and then diet, and then two, her hydration. We were making sure she was drinking enough because it was something so simple that she wasn't thinking because she is so busy. And I just wanted to remind her, be sure that you're drinking enough. Be sure that we're adding electrolytes and sodium to your water because that's going to help with your hydration, but then also to calm her adrenals down because she was so stressed. So, again, it was just a good combination.
Yeah.
And, she made those changes and she's feeling a lot better, which is great.
Yeah, and so when we're talking about body composition, it's not just necessarily weight loss.
No.
We hit it from all avenues. Just for example, talking about people with osteoporosis, a lot of people come in and just like simple exercises you could do that you don't even think about. For example, doing the body weight squat, and you basically have to tax your bones. So like something that you could do very, very simple, just like increase your bone mineral density. If you're at home and you have osteoporosis, if you're in your kitchen, putting your hands under your kitchen countertop and basically trying to do a curl, like you're going to lift up your kitchen countertop as hard as you can for 10 to 12 seconds, and then you relax. You could do the same thing. You could go to your kitchen countertop, standing up and try and push down as hard as you can, 10 to 12 seconds and relax. So essentially you're basically stimulating your bones it's called your osteoblast. You're trying to create more bone, remodel more bone, and that's just like certain, what we show patients in the room, just very, very easy, simple exercise you could do. It's going to take you 30 minutes a day, and it is going to significantly reduce the chance if you have osteopenia going to osteoporosis. And on the inverse, if you have osteoporosis, if you start to do some of these exercises, get on the right supplement protocol, it is not uncommon for you to reverse from osteoporosis back down to osteopenia.
Absolutely so. And that's what it is. I mean, your lifestyle and your habits are really going to shape the terrain, and it's really going to shift your disease, shifts the physiology of your body. So I love to take a full body systems approach to when I'm working with the clients, looking at, again, your whole body and how that's going to factor into your weight loss, because it's not just, it encompasses so much. So
yeah, absolutely.
And then you add that with the right nutraceuticals, the right chiropractor, you're off to a fantastic start for sure.
And since we're speaking of the nutraceuticals, one of the new supplements that we have is the Thermogenesis Complete. And I was actually talking to Mike Gallagher about this, and he was kind of telling me it's essentially 5 supplements in the one.
Nice.
So it was the Garcinia, the Barytone, Tone and Lean, Glucolyze, and the Cholesterol Red. And if you actually look at the ingredients in the Thermogenesis Complete, that's a very easy cheat sheet for me, just because if patients like, if Alicia's fully booked and I can't get her on that schedule that day, hey doc, is there anything I can start with? Yeah, right there.
Right,
because
exactly.
it's literally 5 in 1. Not only is it going to help, so essentially what the Thermogenesis Complete is, it's an appetite suppressant without being a stimulant. So you're not going to get that crazy jittery feel or anything. And the best way to kind of take that supplement is, they recommend a dosage 3 a day. If you just take 1 before every single meal, anywhere roughly 30 to 60 minutes before the meal. And it also rebalances your hunger hormones, and it also reduces blood sugar, and it's going to speed up your metabolism. So it is literally essentially 5 different supplements that aid in kind of weight loss and suppressing your appetite all in one.
Right.
Yeah, so that's and then Phil, do you have that that picture I sent you? So people that started the Thermogenesis Complete, everybody wants the quick fix, right? Hey, I'm taking something, I better be seeing results in a couple of days or like a week or two, right? This actually just so this was one of the studies that came out. I think this was 5 years ago, and this talks about this is called, Mikey G calls it the OB1. So this is basically one of the chemical compounds in the Thermogenesis Complete. And then if you look at this study, this was over 102 different people, and this was without any kind of lifestyle modification. This was literally just taking this supplement, not changing their diet, not changing their exercise. And if you look at the baseline, and then after 4 weeks it tailors a little bit, but then after 2 months of taking this supplement, you could see, especially with this ingredient, the OB1, week 8 to week 10, that's ridiculous compared to the
Right.
placebo effect, right? So there's absolutely no placebo effect with this. When you look at the control group compared to what that ingredient in the Thermogenesis Complete does, I mean, that's like stupid results right there, right?
And just imagine when you combine that supplement with the lifestyle and diet modifications, like it's a game changer.
Oh,
It really
and-
is. You know,
and-
it's going to be it's a dynamic duo. You can't do it with just supplements alone. You have to shift that lifestyle. But when you combine the two,
Yeah.
it's good results for sure.
Absolutely. Change of the diet, exercise coupled with that. I mean,
Yeah.
you're going to literally just shed weight.
Right, for
Yes.
sure.
So if anybody has any other questions with any kind of like lifestyle modifications, just to feel better in your own skin, just what we're talking about, if you have any kind of autoimmune condition or if you have any kind of diagnosis, you're like, hey, I don't want this to rear its ugly head. I kind of want to get ahead of it to delay the progression of it. Come in, pop on my book, pop on Alicia's book. We got a wealth of knowledge over here, and we'll get you back on the good foot there.
Yeah, absolutely, for sure.
Yeah, so thank you guys for sticking with us here for the 12 o'clock hour. And I guess we have the next speaker is Phil. When's the next presentation? Monday?
Okay.
Okay, so tune in on Monday, and thanks for joining us. Happy fall. It's day 1 or 2 of fall? I can't remember.
Yeah, day 1 or 2 or fall. I've got my leaves on here representing fall. And so stop on down Wellness Week 104. We would love to see you, chat with you, get some supplements, get some education, some free food. And we'll be here till 4 o'clock today.
4 o'clock today. All right, guys, have a great